Howdy, my name is Nancy Wynn, Program Coordinator with Watch Your Back, Alcohol and Other Drug Awareness Programs. We are here today with Texas A&M AgriLife Extension Service and funded by Texas Department of Transportation, TxDOT. We want to thank you for the opportunity to present a very important topic. Today, we're going to learn about the science of brain development, effects of the brain on drugs, and how it relates to Texas traffic safety. There is a lot of misinformation out there about alcohol and drug use, and you've probably heard many of these myths, like waiting until someone hits rock bottom before getting help, or some folks will say it'll never happen to me, just one drink. And you may have gone to a party where you may have seen kids drinking and they offer a cup of coffee or milk for them to sober up and get behind the wheel. These myths that alcohol or drugs use is a matter of willpower. That's another myth. So myths like these keep this country from addressing substance or alcohol use disorders, addiction like a medical condition, and contribute to the stigma and shame surrounding addiction that keep people from asking for help. The goal of today's presentation is to present and prevent drunk and drug driving, dispel these myths about alcohol and substance use disorders by presenting the basic science of addiction. Let's start with the basics.
What is addiction? Also called a substance use disorder. Over 21 million people nationwide suffer from addiction, and 1 in 7 people will experience addiction at some point in their life. Recent increases in the use of opioids have compounded the problem. Each day, we lose 174 people to drug overdoses, and that number climbs to 415 if you factor in alcohol-related deaths. Scientists first began to understand addiction as a brain disorder in the 1950s. Doctors Olds and Milner, in laboratory studies of rats, found the parts of the brain affected by addiction. But then, in 1994, Doctors Volkoff and Schelbert, top neuroscientists, ran PET scans of the brain that showed the effects of substance use disorders. Like other diseases, these scans showed it affected tissue function. There are 2 main parts of the brain affected by drug use: the limbic system and the cortex. The limbic system, located deep within the brain, is responsible for our basic survival instincts. So when you do essential things to stay alive, like eat, drink, find shelter, have sex, or care for your young, your brain reinforces behaviors that cause the release of dopamine from this region. That reward for surviving is also transmitted to the amygdala and hippocampus, which records a memory of that feeling, so we seek it again. This is our survival hardwiring. Addiction also affects this area, up here, in the prefrontal cortex, which is what separates us from other animals. This is where decision-making and impulse control live. When drugs or alcohol are used, they activate the same dopamine process in the survival center, and when use is repeated, that substance can hijack that part of the brain. This hijacker changes the brain and weakens this system to make it believe that the primary need for survival is the drug. In hijacking the brain, it can usurp those primary motivations: food, water, shelter, sex, and protecting our young. And the hijacker needs more and more of the substance to activate the same level of reward or feeling of pleasure, causing the brain tissue to become increasingly damaged with continued drug use. So why don't all people who use alcohol or drugs become addicted? There are factors that contribute to the development of a substance use disorder, including individual factors, like genes and age of exposure, and then environmental factors, like drug availability. But there is good news. Addiction is preventable. The key factors that aid in preventing addiction can be categorized into 2 parts: risk factors and protective factors. Protective factors range from parental involvement, programs that improve self-control, limiting availability, and increasing attachment to your community. Another key element in preventing substance use disorders is to delay when use begins. Put simply, prevention is about delaying the onset of first use. In the adolescent brain, where brain tissue is more vulnerable, the hijacker is more prone to weaken the brain and plant itself as a disease. Those with substance use disorders commonly initiate first use much earlier, between 12 and 18 years old, which increases the likelihood of the hijacker taking hold. But if the hijacker takes hold, addiction is treatable. Advancements have been made in assessments, detox, treatment programs, recovery supports, and medications to treat addiction. Brain scans show that once in recovery, the tissue in the limbic system and cortex can get better. With your help, we can expand these innovations to help millions of individuals and families and ensure that addiction is treated as the medical issue that it is. Together, we can solve this. Join us.
Wonderful video. Quick, studious question. Substance use disorder. Have you heard it? The definition is a formal medical diagnosis from the DSM-5, something doctors use. The way they define it is it's chronic, relapsing, constantly recurring. Addiction is a severe form of a substance use disorder, also known as SUD, a chronic relapsing brain disease that is characterized by compulsive substance seeking and use despite harmful consequences. The brain, all it wants is the drug. Addiction in simplest terms. According to the research in 2016, in the United States, over 21 million people suffered from the substance use disorder, and 1 in 7 people will experience a substance use disorder at some point in their life. The severe form of substance use disorder is commonly known as an addiction. Each day we lose about 174 people to drug overdoses. They're gone, and we can't fix it. So this numbers are alarming. The number climbs to 415 when we factor in alcohol-related deaths. We learned from the video that the scientists first began to understand addiction in the 50s, and a major breakthrough came along in 1994, when brain scans showed that the addiction, like other diseases, affected the tissue function, particularly in 2 key parts of the brain, the limbic system and the cortex. The parts of the brain affected by addiction are important to note because they help to explain certain behavior changes that are commonly associated with the development of a substance use disorder, and why people are struggling with severe addiction can seem like a total different version of themselves. One key part of the brain affected by the addiction is the limbic system, which is responsible for our basic instincts and survival hardwiring. In the video, we met the hijacker. Remember the hijacker? And we learned about how over time addiction can trick a person's survival hardwiring to make them think and really believe that a substance is the primary need for their survival, above all other primary motivations such as food, water, shelter, sex, and protecting our young. Brain tissue becomes increasingly imbalanced with continued drug use. So early intervention and engagement in treatment are very important for increasing the likelihood that a person will recover. Here are the neural images showing differences in the survival circuit in a healthy brain compared to a brain affected by addiction. The left side shows the healthy brain. The right side shows brains of people who are addicted to various substances. One thing common to all addictions is this decrease in response to dopamine in the survival circuit discussed in the video. As youth, you may be aware of the zero tolerance of any alcohol consumption, and I have no doubt that you understand that drug abuse or any type of drugs can be high consequences and illegal. Watch Your Back's mission is to create safer roadways through alcohol and drug awareness programs. If you ever find yourself in a predicament where drugs or alcohol are involved, Remember to plan while you can. Okay. We can't be there to take that drug away from you or take your friend's drug away, but plan while you can. Remember that buzz driving is drunk driving. Remember, driving high, you get a DWI. The costs are too high, both financially and physically. You've got to take good care of your health. Alcohol and or drug use also affects the prefrontal cortex, okay, which is the part of the brain that separates us from other animals, and it's responsible for impulse control and decision making. With this information alone, it is important to understand the high cost of drinking or drug driving. So again, it's taking from the decision making. If one just happens to decide and know beforehand that they're going into a place where there's going to be alcohol and drugs, plan while you can. Have a safe word for your parents to pick you up, or know that you are not getting in a car with someone who's been intoxicated, and encourage them not to get in a car. It's very important. It can end tragic. So the important thing is to plan while you can and make the right decisions before you make a high cost decision. The recent scans show that changes in the cortex, and the arrow is pointing to the prefrontal cortex here. Here are neuroimages comparing a healthy brain to a brain affected by cocaine addiction and a healthy heart to a diseased heart. A heart disease damages the muscles in the heart, the bottom red arrow on the slide, which interferes with the heart's ability to pump blood out to the body. Similarly, addiction damages the red top arrow on the slide. You see that? Similarly, addiction damages many different areas of the brain and interferes with some important cognitive functions of the brain. Most people will use substance at some point in their life, and most adults who use substances do not develop a substance use disorder. Why is this? Why doesn't everyone who uses drugs or alcohol develop an addiction? Well, there are three main factors contribute to the development of substance use disorder. Think of them like a triangle. Okay, there's the individual factors, like the age of the first year. The second is environmental factors, like the availability of drugs, the access to alcohol. And the third is genetic factors, like a family history of addiction. Your grandma, your grandma's grandma, your grandpa, your grandpa's grandpa. It's a genetic factor. The most effective way to deal with addiction is to prevent it from happening in the first place. Risk and protective factors influence the likelihood that a person will use substance and whether they will develop a substance use disorder. Prevention of substance use disorder involves reducing the risk factors and strengthening the protective factors. Assessing your own risk factors, like increase the likelihood of beginning substance use, of regular and harmful use, and of other behavioral health problems associated with use. The protective factors directly decrease the likelihood of substance use and behavioral health problems, or reduce the impact of risk factors on behavioral health problems. Not all adolescents, not all young children or young teenagers who use drugs and alcohol will develop a substance use disorder, even if they have experienced some of these risk factors. But the misuse of alcohol and other drugs and driving can cause a lifetime consequence. The presence of multiple protective factors can lessen the impact of these risks. And as you see here in the slide, identify which ones you currently have in your life. Assess that. Risk factors here can be influenced at many different levels, from federal policies to school-based or mentoring programs to family education on parenting and effective communication. So if one has a risk factor, or 3 or 4, these can actually be reduced if we start implementing more of these protective factors. It's important to highlight one very important protective factor: delaying the onset of substance use. Wait, just wait, put it off, find other things to do, and list it under your protective factors. When a person starts using drugs or alcohol for as long as possible, they have a better chance to retaining a healthy brain. The human brain is actively developing until the early to mid-20s. This image shows a healthy brain development from the age of 5 to 20. The image shows healthy brain development from 5 to 20 years old. The blue represents maturing areas of the brain. The red, green, and yellow represent vulnerable developing areas, weak parts that haven't completely developed. It is because of these developing areas, the vulnerable ones, that the adolescent brain is able to learn more quickly than a mature adult brain. However, these areas also make the adolescent brain much more vulnerable to harmful environmental and substances and the maladaptive learning of harmful behaviors. So as easy as one can use and learn good information, it can also be vulnerable to learning the negative and bad information. And it falls back to those risk and protective factors. So if you're learning more from your protective factors, then you're maturing, your brain is more blue. But if you're in an environment where there's a lot of risk factors, well, those colors are going to be changing rather quickly. So again, risk and protective factors are very important to identify and then add more protective factors in your environment and within your life. Let's go. We discussed prevention of alcohol and other drug use. As you sit through this presentation, you may have identified a friend or a family member, just think about who may be struggling with an alcohol or substance use disorder. Please know it is treatable. There have been major advancements in how we treat substance use disorder and addiction. Just to name a few, thousands of physicians, doctors are trained to treat addiction in medical schools across the country are starting to include addiction training in their curriculum, which never happened before. This is new. This will help to ensure that substance use disorder treatment is integrated in the general health care. Like if you have a cold or if you have a headache, what's going on? They want to learn more and make sure that they understand the addiction, which will lead to better outcomes for patients. And then there's medications. There are 3 FDA-approved medications for treatment of opioid use disorder: methadone, buprenorphine, and naltrexone. Combining medication with counseling is considered the gold standard for treating opioid use disorders. These medications restore balance to the parts of the brain that are impacted by addiction, stabilizing the patient to allow them to work towards recovery. Medications also exist to treat alcohol and tobacco misuse. So, to put it in perspective, you may or may not have heard of some type of opioid that helps, that is prescribed, It's usually prescribed when someone accidentally breaks their leg in a sport or they tripped and they hurt themselves, and a doctor in the past and still does prescribe an opioid, and it's become an epidemic, and without them knowing, they become addicted and now they have a problem. So doctors have created a medication to reverse that and help them get out of that addiction. So doctors and research have developed sophisticated assessment tools that enable them to diagnose a substance use disorder and identify the severity of the illnesses. Research has also shown that engaging in treatment for an adequate period of time is critical, that recovery requires long-term support. So then there's treatment, which comes to an end, but you've got to have those protective factors, and that's going to help with the long-term support. Many individuals will need 3 to 5 years of treatment or more. Long-term support services are key to living in recovery. And these can include like mutual health groups such as 12 Steps, a church group, Smart Recovery, or even peer-to-peer support services. And recovery support employment, housing, and schools. All of that is available to implement for your protective factors. The good news is that the brain can recover. Here is the brain scan of a survival circuit in a healthy brain compared to the brain of someone with a methamphetamine addiction, after 1 month abstinent and then 14 months abstinence. Here you see healthy person, meth user 1 month abstinence, and then meth user 14 months abstinence. See how the activity in the survival circuit starts to regain normal levels with prolonged abstinence. Prolonged meaning they're staying away longer, and abstinence is from any type of drug. As this part of the brain recovers, cravings will be reduced and the drive to use the substance will go down. This isn't easy for a lot of folks who are trying to recover from a substance or alcohol use disorder, addiction. Treatment needs to be planned to best suit the individual needs of the patient. No single path or method is appropriate for everyone. Appropriate methods of treatment will also vary depending on the type of substance or substance a person is misusing, as well as the severity of the person's disorder. And that is assessed by the person's frequency of use and their family history and other areas. It's quite involved when you do an assessment, you or your loved one. In summary, just bringing all of this together, substance use disorder is a brain disorder. Alcohol or substance use disorders can be prevented and treated. We want you to understand that it is very important to delay the age of first use, identify and intervene in problem areas or problematic substance use as early as possible. You know, if it's down to twice a month, that's concerning. That is a habits forming and possibly a substance use disorder. People can and do recover from this disease. There are many paths to recovery, and each one requires a long-term support, family support, church support, self-help groups. Those are all very important. Together we can bring awareness. Join us, okay? And if you're worried about someone or your own substance use, talk to a trusted adult. Call the crisis line or text NAMI 741-741. There's also smartrecovery.org where they have live chat groups, or visit addictionresourcescenter.org. Here are the references of the information that was brought together for this presentation. We're very grateful for this resource and continued support. If you have any questions or you would like to host a Watch Your Back presentation in your community, please contact one of our team members. We have Bobby Brooks, who is our program manager, Ben Smith, program coordinator, Nancy Nguyen, which is myself, program coordinator, and Jeffrey Pierce, program coordinator. Our contact information is there. And before it becomes legal issues, driving while intoxicated or driving under the influence, we want to help individuals and family through our alcohol and drug awareness program. Spreading this information is our best way to combat the stigma and begin change and improve our response and behavior statewide. So having said this, I put together a little activity sheet for you, and you should have that by now. So I'd like for you to take a moment to complete that activity sheet and test your knowledge. Now, if you have a little hiccup in your brain or a little brain fart, just go back to the video and look for your answers. Listen for your answers. You will find them. Good information. Last but not least, please like Watch Your Back on our social media platforms, on your social media platforms, Instagram, Twitter, and Facebook, and give us a shout out, okay? Mention us. Thank you for joining us together. Excuse me. Thank you for joining us today. I hope it brought us together. Thank you.